I didn't have a really good understanding of EKGs, and although I've worked in different areas, even despite buying different books and going to different classes, I never really had solid foundation for EKGs.
I had been researching, looking for a course, a program. I bought books and materials, but nothing actually seemed to help.
Before learning with Dr. G, I was able to kind of get by with my EKG interpretation.
I was completely lost the ability to read EKGs or lack confidence of my ability to do or read EKGs since I don't do this on a regular basis.
But the concept of EKG has been kind of like a mystery.
I really honestly relied a lot on my peers to help with reassurance, and my confidence was pretty low with interpretation.
Before the class with Dr. G, I was going to my collaborator directly for EKG assistance, even for the basics.
I didn't have any confidence at all looking at an EKG. Really, whatever the computer said was going to be probably what it was.
So before I purchased the course, I was not very confident. Couldn't really tell you a lot about EKGs, even though I'd been around them my entire career.
Before I did the Dr. Z EKG course, I was thinking EKG is the most worst confused.
I went to one of her sample free lectures and I saw the way that she taught. And from seeing that it was going to work for me, that's how I chose Dr. G to teach me about EKGs.
She's a nurse practitioner, and a great educator, comes from a family of educators, and you could tell her approach was definitely rooted in those.
But I did do the introductory course, and I learned several things just in that.
And what really drew me to her was when I reached out to her about a class that I wanted to take that I didn't see. She was very prompt in returning my message and reaching out to me, letting me know when the next scheduled lecture would be, in addition to the actual calendar, and how personable she was even on that level.
So now I'm able to see EKG and understand if it's normal or abnormal, and if I need to do any further intervention for my patients, especially for the preoperative clearance, because I work in a primary care provider.
After the class with Dr. G, I'm more confident. I'm able to go to my collaborator with what I see and able to dive more into the plan and goals for the patient instead of spending as much time of reading the EKG.
It was great being able to give a case study of some of my patients and get that feedback immediately.
I really feel like my confidence has soared through the roof. I know what I'm looking at. I'm much more accurate with the interpretations now than I was before. And I have improved outcomes and recommendations for my patients because of it.
One of the things I enjoyed is her overall knowledge and her ability to break down the EKG and develop it in simple terms, so that way I can understand and comprehend how to properly interpret EKG.
Dr. G, the NP, is amazing as an individual as well as a brand. She's passionate about patient care and teaching her fellow nursing colleagues.
Utilizing your services was to gain immense confidence completing and reading EKGs. And I did achieve that through your course.
I would tell all my friends and my colleagues and even my nurse practitioner student, please attend Dr. Z EKG video or EKG.
I say go get it, especially if you're lost or you just need a refresher.
And of course, she's your go-to for all EKG related situation and needs.